Some of the nation's top health officials are pushing back after President Trump falsely claimed that the CDC has exaggerated its coronavirus fatality count. Yesterday, he blamed the agency's method for determining what constitutes as a COVID-related death compared to other countries around the globe. His comments come as the U.S. death toll surpasses 350,000. Last month, the virus took the lives of more than 77,000 people across America, surpassing the previous high in April. At the same time, the nation continues to fall behind with its plan to vaccinate Americans. 13 million doses have been distributed so far, but only 4 million people have actually been injected. That is far less than the federal goal to have 20 million people starting their inoculation process by the end of 2020. For more on this, let's bring in Dr. Ron Elfenbein. He's the medical director and owner of First Call Medical Center. Dr. Ron,
Morning.
We've known for months, Happy New Year, first of all, good to see you.
Thanks, you too. Happy New Year.
We've known for months that coronavirus vaccines were coming. And, I understand, I think a lot of people understand that this was going to be a massive undertaking by the federal government and by the states, and that there were bound to be hiccups. I mean, nothing like this has ever been really attempted before, at least in modern American history. And so there's bound to be hiccups. But are you surprised that we are behind by as much as we are?
Yeah, I think you hit the nail on the head there, Vlad, that it's a really big undertaking and a difficult one. Yes, I am surprised that we're as far behind as we are. And I think that's sort of speaks to the inefficiencies of government in general. I think it would have been great if we really had rolled it out and already had 20 million people vaccinated by the first of the year, which kind of was the goal. But it really is a huge, huge logistical undertaking and a big, nightmare in that perspective. I think the UK actually has switched to now, they're not even worrying about the second dose of vaccine. They just authorized the AstraZeneca vaccine, which they probably won't do till February or March. And they just basically said, forget about the second dose. We're just going to give everybody the first dose and hope that this works. Now, I'm not advocating that because there's really no data for that. And they're kind of going out on a limb. But they're going to get millions and millions and millions of people, more people vaccinated than we will, because they're taking that strategy. So you got to remember that the problem with this vaccine is that it's both the Pfizer vaccine and the Moderna vaccine, which are the two that are authorized in the United States. You need a second dose, and it's either 21 or 28 days apart, and you have to be within a couple of days of that. So you have to plan. You got to make sure that the people you're giving the first dose to can get back to you within 21 or 28 days to get that second dose. So, it's really a difficult undertaking, to say the least. But yes, I am disappointed that we're far behind our goals.
I want to drill down a little bit more on what the UK is thinking of doing or is doing, which is inoculating more people with the first dose, and they'll worry about the second dose later, but just getting the first shot into as many people as possible. That's clearly what they're choosing. Others have debated the idea of maybe giving people two half doses instead of 2 full doses. To me, that doesn't sound like, not only does it not sound like how the vaccine's supposed to work, but also it seems, with my limited knowledge, like it could be problematic down the road. I mean, don't these viruses evolve and change when they, meet roadblocks? Can you talk a little bit more about choosing either, 1 shot or 2 half doses, and whether or not there could be something harmful that results from that?
Yeah, Anne-Marie, that's a really good question. We don't know the answer to that. So the AstraZeneca vaccine, the Oxford AstraZeneca vaccine, is very interesting because, and one of the reasons why it's being held up in the United States for being authorized is the original study that was done only showed 63% efficacy. Now that 63% was sort of all takers, all comers. And the reason that there was a problem with that was because the first people that got 2 full doses were very, very, very low. There was like 62%, 63% efficacy. But then they did half a dose and a full dose, and they found that it was 90% effective. So then the question became, well, was it that the second dose the first dose was a half dose, or was it the fact that they delayed the second dose by, I believe it was up to 6 weeks or 90 days or something like that? We don't know the answer to that. So, we do know that again, historically speaking, that the immunity that people get to coronaviruses wanes very quickly, sometimes in 12 months, sometimes in 18 months, sometimes in 2 years. We don't know what the long-term efficacy of the vaccines are to begin with. So we don't understand the immunology with regards to this particular vaccine or any of the vaccines, really. If you gave a half dose, if you gave 3/4 of a dose, if you waited, X number of days. I mean, it's been studied 21 and 28 days. We don't know if you waited 6 months, what would happen, or 30 days or 90 days or whatever. So, they're really, the UK has a very bold strategy, but it really is kind of playing with fire, because you're right that any sort of microorganism that has pressure put on it will find a way to avoid that pressure. So, if the pressure is not applied very, very forcefully, it will find a way faster to avoid that pressure. So, your question is a good one. Will it cause faster mutations, or will it cause the virus to be able to escape the vaccine quicker? I don't know the answer to that, but presumably yes, if it doesn't work. So their big experiment could cause big problems if it fails.
Yeah, it's so interesting, Dr. Anamarie, because, you always hear from doctors with whatever it is that you have. If there's a prescribed treatment or a prescribed vaccine, or in the case of bacteria, a prescribed antibiotic, they always tell you, don't stop, or, they take the full dose, because if you don't, then you run the risk of some of the things that we're talking about here. And I get that there's a difference between a virus and a bacteria and some of the other things. But even physical therapy, when they say you got to go to physical therapy, they say, don't just go for 2 or 3 days, go for the entire prescribed time, because that's how you get better. That's how you heal. That's how you combat disease and infection. So it is kind of interesting that the UK is choosing to go this route. That being said, doctor, as you know, after Thanksgiving, we saw a spike in cases and in hospitalizations and deaths. And now during the December holidays, we've got this new, more transmissible variant of the virus. So, are we going to see a post-holiday surge on top of the surge that we've already seen?
Yeah, I think we definitely will. I think that there's going to be more people in the next 2 weeks, I would say, that are going to be coming down, as you say, a surge upon a surge. I mean, if you look at your pictures there, I don't know when that footage is from, but the airports are packed. People have been traveling for New Year's and for Christmas, and we're going to start seeing those numbers spike in the next week or week and a half. I don't think there's any way around that. I just think that that's sort of exactly what's going to happen. It's very predictable, and it's unfortunate, but I think that that's exactly what's going to happen.
Yeah, it's going to be a tough January, I think. You talk about the surge after Thanksgiving, Vlad, but we're still in it.
Right.
We keep talking about these hospital beds, particularly in California. That's the side effect of the surge that we are currently living, and now we're probably going to go headlong into another one. Dr. Ron Elfenbein, thank you so much.
Thank you. Happy New Year, guys. Stay safe.
Happy New Year, Doc.